May I now call upon Chief and Presenting Author Dr. Kriti Bhatt to present her paper on prevalence of dry eye, categorization and pathological correlation, a tertiary case study.
She is a non-ratified member, so you will not be considered for the award. Okay.
A very good morning to all. I am here to present my paper on prevalence of dry eye, its categorization according to DUCE2, and pathological correlation, a tertiary care hospital-based study. Dry eye is a major healthcare problem and one of the most frequent cause of visit to an ophthalmologist. DUCE2 in 2017 defined dry eye as a multifactorial disease of ocular surface characterized by loss of homeostasis of tear film and accompanied by ocular symptom in which tear film instability and hyperosmolarity, ocular surface inflammation and damage, and neurosensory abnormality play an etiological role. The aim of my study was to find the prevalence of dry eye in a tertiary care hospital with the objective of to diagnose and classify dry eye according to DUCE2 classification into aqueous deficient dry eye, evaporative dry eye, and mixed variety, and to determine the associated risk factors and look for grade of squamous metaplasia in each group. This was a cross-sectional hospital-based study carried out over a span of 1 year. We included patients more than 30 years of age who were selected via systematic random sampling, and we excluded patients having any active ocular surface infection, history of any contact lens wear, dryness of mouth or enlarged glands, history of any intraocular or extraocular surgeries within past 12 months, or use of any topical eye medications. The subjects were given dry eye questionnaire 5, and patients having dry eye questionnaire 5 score of more than 6 underwent fluorescein breakup time and ocular surface staining using Van Bistedville score, and any patient having dry eye questionnaire 5 score of more than or equal to 6 and at least one positive objective test were labeled as dry eye disease patient, and they were further subcategorized into aqueous deficiency, evaporative, and mixed variety based on tear meniscus height and slit lamp examination, and those who gave consent were further evaluated with impression cytology. A total of 897 patients were screened in our study, of which 485 were males and 412 were females. And the prevalence of dry eye from our study was found to be 29.54%, of which aqueous deficiency was seen in 37.4%, evaporative in 37%, and mixed in 25.7%. This pie diagram and bar diagram depicts that the prevalence of dry eye was found to be more common in elderly, more than 60 years, followed by third decade, fifth decade, and fourth decade. It was found more prevalent among females and urban dwellers, and diabetes, psychiatric illness, thyroid, smoking, and history of previous cataract surgeries more than 12 years and use of visual display terminal devices were found as significant associated risk factors. The impression cytology in different subtypes of the dry eye showed a reduction in goblet cells, and a marked reduction was seen in mixed variety of dry eye. And this slide depicts the grading. We found different grades of squamous metaplasia among dry eye patients, and the mixed variety showed a higher grade of squamous metaplasia compared to other subtypes. Dry eye, being a major healthcare problem, is overlooked and underdiagnosed due to lack of standard dry eye diagnostic criteria. Our study thus used the most recent diagnostic criteria as proposed by DUCE2 for diagnosing and categorization of dry eye patients, and the prevalence in India ranges from 18.4 to 54.3%. And the prevalence of dry eye found in our study was 29.54, which fall in the above range. We found majority of patients in the age group of more than 60 years, decreased tear secretions, increased meibomian gland dysfunction, and thinning of the lipid layer with advancing age may be a probable explanation. The dry eye was also found to be more prevalent among females, which could be due to hormonal changes, and more prevalent among urban dwellers. This could be explained due to increased uses of visual display terminal devices, air conditions, and presence of air pollution in the urban population. Major limitation of our study was that it was a hospital-based study, so the study may not represent the real picture at community level. Secondly, it was a cross-sectional design, so it restricts our ability to infer into the causality, and all cases of gross corneal conjunctival pathologies, contact lens users, use of topical medications, systemic conditions were excluded from our study, thereby underestimating the dry eye prevalence. Fourthly, the impression cytology could not be performed in all dry eye subjects. Thus, to conclude, the hospital-based prevalence of dry eye was found to be 29.5%. Thus, our study reflects a major burden of dry eye on routine outpatients. And our study also showed that age, sex, residency, and occupation have a significant impact in the development of dry eye. And reduction of goblet cells and different grades of squamous metaplasia were observed among dry eye patients. Mixed groups showed a marked reduction of goblet cell and a higher grade of squamous metaplasia. These are my references. Thank you.
Thank you, Doctor. Good study. Any question from the guys?
Thank you.